Good morning. Can you guys hear us at Southern Nevada Health District? If you're testing your audio, we can't hear you.
Hi, Autumn. Can you hear us now?
Yep, we can hear you.
Oh, excellent. Thank you so much.
Yep.
That's what it was called for the computer audio. So it's just a jack mic.
This is Zoom?
No, Teams. Oh, Teams. You know the Microsoft Teams? Instead of Skype, that's what they want to use. The Teams. So instead of Skype, they wanted
About the same. Dando casos. Morning.
Okay, good. That's awesome.
Good morning. Can the number ending in 1131 please identify themselves for the minutes?
This is Louise Bittner. Hello.
Thank you so much, Ms. Bittner.
Appreciate your help this morning.
With the username LarryRackleyFarm.com, can you please identify your last name for the minutes?
Rackley, Rackley.
Thank you very much.
I'm a Pershing County Commissioner.
Would the individual with the phone number ending in 3155 please identify themselves for the minutes?
Tracy Pistone with Interim Healthcare.
Can you say that one more time? I apologize.
Sure, Tracy Pistone, Pistone with Interim Healthcare.
Thank you so much. Would the individual with the phone number ending in 0034 please identify themselves for the minutes?
Yes, Brad Waples, Acting Manager, Medical Laboratory Services.
Thank you, Brad. Would the individual with the phone number ending in 6224 please identify themselves for the minutes?
Steve Smith, Las Vegas Fire.
Thank you so much.
Are we all set up? This is Dr. Pennel, John Pennel.
Good morning, Dr. Pennel. Let me just identify one individual who came on via the phone, and then I think we should be able to get started.
Thanks so much.
Would the individual with the phone number ending in 1933 please identify themselves for the minutes?
This is Sheila Licious-Hill with Sparks PD.
Thank you so much.
Good morning, everyone, and welcome. I call the meeting of the Nevada Board of Health to order at 9:01 a.m. on December 2nd. This meeting has been posted in the appropriate locations in accordance with the Nevada Open Meeting Law. May I have roll call, please?
Dr. Pennel?
Present.
Dr. Murawsky?
Present.
Dr. Ponce, Mr. Smith,
Present.
Ms. Bittner,
Present.
and Dr. Larson.
Present.
Thank you so much. We have quorum.
Thank you. A public comment period will be offered for each action item as it specifically relates to the action being considered. All public comment not specific to today's agenda will be heard during the general public comment period at the end of the meeting. Because of time considerations, each person offering testimony during the public comment period will be limited to not more than 2 minutes, and a clock will be kept. Use of obscenities or other behavior which disrupts the meeting will not be tolerated and may result in the forfeiture of the opportunity to provide public comment or removal from the meeting. I'm not able to attend today's meeting in person and will now turn the meeting over to Dr. Murawsky, our Vice Chair. Dr. Murawsky.
Thank you, Dr. Pennel. Our first action item number 2 is approval of the meeting minutes from September 2nd, 2022. I'll look for a motion to approve and a second.
Motion to approve.
Second, Charles Smith.
Is there any public comment? Noting none. Vote from members of the board. All in favor, say aye.
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 Any opposed, say nay. Motion carries. Minutes are approved as provided. Number 3 on the agenda is an informational item. These are the quarterly county and district health reports. We've received reports from Carson City, Washoe County, the Southern Nevada Health District, Douglas County, Churchill County reporting for Mineral, or Mineral reporting for Churchill, Elko, Lander, Lyon, Nye, and Pershing. If any of the health officers wish to make comment, we'd welcome them to do so at this time. Please raise your hand and let us know that you'd like to provide additional comment other than your reports. Autumn in the South, Dr. Legwin from Southern Nevada would like to make comment. Is there anyone else that would like to?
Kevin Dick has his hand raised as well.
Excellent. All right,
This is Vicki Aker. I would like to as well. I just can't find where to raise my hand. I'll find that.
Why don't we start with these here, and then we'll let folks figure out how to push the hand up button. So this is the Southern Nevada Health District. Thank you.
Fermin Legrand, District Health Officer, Southern Nevada Health District. Thank you for allowing us to talk here today. First, I want to share with the board that our region, similar to the rest of the state, has been dealing with a large number of respiratory infections among children, mostly related to RSV infection. Our hospital, pediatric hospital, has been adversely affected by that, with a large number of children coming to the ER and a large number of admissions, and they have been suffering from a shortage of staff in those hospitals. We also want to recognize the effort from the state and the governor's office that they have been very responsive to our needs and requests from the Nevada Hospital Association, and they have actually put in place some measures that will certainly help our hospitals. I also wanted to share with the board that the Southern Nevada Health District recently received a $22 million grant from the CDC, and this is for public health infrastructure. This is a 5-year grant that will help us sustain and expand our workforce and allowed us to do several projects in our community, especially related with health equity and other areas of need that we have here. I also want to take the opportunity to advocate for sustainable public health funding for public health in Nevada, and we hope that in the future we could see something like that accomplished here to provide sustainability across the state, and that's how much. Thank you.
Thank you very much. All right, thank you very much. Any questions from the board? Thank you. All right, why don't we hear from Mr. Dick, the health officer at Washoe County?
Yes, thank you. I just wanted to highlight a few things. We've had some changes in the District Board of Health for the Washoe County District Board of Health with Councilman Delgado resigning from the Reno City Council. He has been replaced with an appointment of their Vice Mayor, Devin Reese, who's now joined our board. We also had Commissioner Bob Lucy resign from the Board of Health, and Commissioner Alexis Hill has been appointed to the board. That's through the remainder of this year. And then the Washoe County's elected appointee will be selected in January for a 4-year term on the board. Since Councilman Delgado was our chair and Commissioner Lucy our vice chair, we also had new officers that were elected by the board. So Councilman Christopher Dare is now the chair of Board of Health, Councilman from Sparks, and Mike Brown, the Reno appointee to the board, is the vice chair. Those terms will run through the end of the year, and we'll have elections for new 2-year terms coming up in January. We've also had an amendment to the interlocal agreement for that establishes the Washoe County Health District. There was concern about confusion with the health district people. Sorry, I'm hearing an echo. That sounds better. There was confusion with people thinking that the health district was part of Washoe County government. And so this interlocal agreement, which becomes effective, the amendment to it comes effective January 1st, will change the name of the health district to Northern Nevada Public Health, serving Reno, Sparks, and Washoe County. And we won't be formally rolling out that new name right away. We're working to bring a firm on to assist with the rebranding effort, and we anticipate that occurring in summer of 2023. I wanted to acknowledge and thank Julia Peak with the Division of Public and Behavioral Health for her efforts on our behalf of securing us some ARPA funding through the state, and that was approved by the Interim Finance Committee. That will provide us with $10 million to be able to get a new building to replace the facility that we have for our TB clinic, as well as to provide some much needed space for some staff to be able to move into for the health district, and also funding that will allow us to continue to provide family planning services over the upcoming 4 years because of the failure of the federal government to provide us with Title X funding to continue our family planning services. So very much appreciate Ms. Peak's efforts on our behalf and the state providing those funds for us. Similar to Southern Nevada, we are seeing our pediatric hospital capacity full, largely because of the RSV outbreaks that we're seeing. We're currently, through last week, 750 RSV cases so far for this season. We're 7 weeks into the respiratory disease season, and at 750, that's what we would hit in a year in the past for the entire respiratory disease season. So that runs through the first 20 weeks of 2023. Again, also want to acknowledge the efforts of the governor's office and the state in working with us and the hospitals to come up with solutions and path forwards on addressing those capacity issues that are occurring. And then also just wanted to mention something kind of neat that we have a grant from the National Association of County and City Health Officials for our food safety program to mentor other public health agencies' food safety programs. And we were asked to mentor Guam and Saipan. And so we had staff recently that visited those islands and worked with their food safety programs and found how different conditions are in those areas versus what we operate in. So I think it's going to be very beneficial for those programs, and it's really eye-opening for our staff and for appreciation of where we're at with public health in Nevada and here in Washoe County. So that concludes my report. I'm happy to take any questions. Thank you.
Thank you. Any questions from the board? Congratulations on the funding and the opportunity. That's love to hear more about that as that mentorship continues. And we don't forget about our Commonwealth partners in the Pacific Islands.
Thank you.
Thank you. All right. Okay, last one that raised their hand, Miss Aker, Carson City.
Good morning on this snowy morning up here in the north. Thank you for allowing me to provide some highlights. As Mr. Dick reported about our Title X family planning, our grant application from the feds was approved but unfunded, and very grateful that Julia Peak and her team and the state have agreed to help us with some of that funding. As you know, family planning is very important in our communities, and we're that safety net for many individuals. And then through our Ryan White program, as you know, yesterday was World AIDS Day, and it kicked off our art exhibit. This is our second annual art exhibit. And these are from individuals that are telling their story through art, and it will be displayed through the month of December in our lobby at 900 East Long Street. So if you're in Carson City, stop by and look at the art and read the stories. They're very impressive. In our tobacco control and prevention program, we're continuing to advocate for the youth vaping prevention funds. Those funds are used to provide education to our youth, our parents, and our teachers about vaping and the dangers of vaping. And then in our EPI division, through COVID, we realized that we needed to separate our environmental health and our EPI programs. In the past, we had those divisions or those programs together under one division. And in COVID, we had to expand very quickly. I'm happy to report that yesterday at our Board of Supervisors meeting, we are able to bring on, as city employees, 2 epidemiologists, 1 additional public health investigator for a total of 3, and also a administrative assistant. And these will be city employees. And so we are very happy about that, and moving forward to get those positions hired. And if you recall, we have human services under our roof as well. And we recently, the Board of Health approved the Carson City Housing Plan. And then this is paid for with ARPA funds. So we had agencies that submitted a letter of intent, and with their projects were looked at and decided if they could go forward with an application. So the individual agencies have submitted their applications, and those will be looked at the beginning of January. So there's 3 phases to this housing plan. One is basically to survive, and that is getting individuals off the street and getting them into a outreach program and have them help and help us as a city keep the city clean and give them purpose. And then we've got Thrive that will move them into some stabilization aspect of housing. And then we have stabilization as a 3rd phase, and that is where they'll go into group living and I think sorry, so that 3rd phase, stabilization, they'll be moving into more permanent housing. So very excited to see that moving forward. And then in our public health preparedness program, we recently hired a contractor to do an after-action report for our COVID-19 response. And right now what's taking place are focus groups. And we're looking forward to seeing that report and seeing how we can improve our operations. And then our community health improvement plan that we collaborated with the hospital and different agencies within the Quad Counties is completed. And we will be getting that up on our website and out to our partners. And then our next step on that is to start on our community health improvement plan. So, and then again, I also want to thank Julia Peak and the staff for helping us get some additional funding, ARPA funds for some staffing. So, and we're also seeing the rise in RSV within our community as well. And that concludes my report, and unless you've got any questions. And I've also got Dr. Lyons on the line if she has any additions.
Dr. Lyons, any additions to make?
I think that the biggest thing that I'd like to comment on is what happened with the federal funding for the family planning. That was very unfortunate. We have community members who were working to try to get that back for us. And because we were offering here in Carson same day and next day appointments for birth control options, which is very important when one is requesting that. And so that funding was unfortunately drastically cut. And that's a problem going forward in our community. And unfortunately, our Quad County report will demonstrate that the Carson City area of the Quad County has the highest teen pregnancy rate. So losing that same day, next day service is concerning.
Thank you. Any questions from the board? Autumn, are there any other health districts or counties that wish to make a report?
I don't see anybody with their hand raised. So I think we're good to go.
Any on the health district reports? Okay, hearing none, we'll conclude that action item. Thank you very much. Thank you all for your reports, and thank you for sharing with us the efforts of Ms. Peak and the board. You know, thanks her for all of her work in helping the districts kind of close that gap, and we'll follow that going forward. Okay, moving on to item number 4, consideration and possible approval of appointments to the Nevada Office of Minority Health Equity, NOHME Advisory Committee. Is Tina Dortch with us?
I am here, thank you.
Great.
Thank you, Mr. Chair. I present to you today 3 candidates for appointment to this to the Nevada Office of Minority Health and Equities Advisory Board. These 3 individuals will, I'm very happy to say, allow the office to have, at this point, a fully seated advisory committee. It's been some time, as you know, individuals roll off and roll on. And with these 3 individuals, we have Northern Nevada coverage that is a requirement of statute to make sure that the composition is ethnically, racially, and geographically diverse. They do present and provide expertise, subject matter expertise, and very, very stellar counsel across the representative at large category, across the healthcare provider category, and across the nonprofit category. We are going to have subject matter expertise when it comes to workforce diversification. We're going to have, again, a very, very critical outreach component through Pastor Whitlock. And then I'm very excited about Mrs. Nancy Bowen. She will be, she's the CEO of the Primary Care Association, Nevada Primary Care Association. So having an AHEC, having a pastor, and having the nonprofit join our rank and file as an advisory committee is very much necessary. And I do expect and hope that if there are any questions, I can answer them to your satisfaction, Mr. Chair.
Thank you. Is there any public comment on these nominees? Hearing none, is there any discussion from the board members? If not, I will look for a motion to approve and second the adoption of the nominees for the Nevada Office of Minority Health and Equity Advisory Committee.
I would move to accept the nominees for the Nevada Office of Minority and Health Equity Advisory Committee. This is Dr. Larson.
Charles Smith, second.
Thank you. All in favor, say aye.
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 Any opposed, say nay. Motion carries. Thank you very much for the nominations, Ms. Gordon.
Thank you, thank you, thank you, Dr. Larson. Thank you.
All right.
Mr. Chair, may I say, I spoke to you quite a while ago.
Oh, John, we lost your mic. Dr. Pennel.
I just wanted to say that Ms. Dorsch, I spoke with her quite a while ago, and she's excited then, and she's still excited now. Congratulations. Good job. Well done.
I am very excited. Thank you so much. I appreciate you, Chair.
All right. Moving on to action item number 5, consideration and possible approval of candidate for medical technologist position on the Medical Laboratory Advisory Committee. Is Bradley Waples with us?
Yes, good morning, Chair Pennel and members. We sent out we have a vacant position on the Medical Laboratory Advisory Committee, and we sent out a notification to anybody that was interested. We sent the notification out to all licensed medical technologists, clinical laboratory technologists, clinical laboratory scientists, pulmonary laboratory technologists, and blood gas technologists to see if there was anyone interested in being on the board and filling the vacant position for that spot on the MLEC committee. And we had 17 applicants that were interested, and they're on October 7th, 2022, we had a meeting of the Medical Laboratory Advisory Committee members. There were 5 members present of the 7, and then plus Dr. Azam, there was 1 person absent, and there was 1 vacancy that we're trying to fill. According to NRS 652.170, number 1, the Board of Health will be the ones to appoint the members for the Medical Laboratory Committee. On October 7th, the members reviewed all of the applications, and they came up with 1 name, and that was Taylor Noyes to fill that position. So I'm here today to present Taylor Noyes as a person to fill that vacant position as the medical technologist.
Thank you. Is there any public comment on the nomination? Are there any questions to the board members about this nomination? Hearing none, I'll look for a motion to approve and a second.
Charles Smith, I make a motion to approve the candidate for the medical technologist position. Can't pronounce that.
Judy Bittner, second.
Thank you. All in favor of the nomination for the medical technologist position on the Medical Laboratory Advisory Committee, please say aye.
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 Any opposed, please say nay. Hearing none, nomination carries. Thank you very much for posting the nomination and moving forward.
Thank you very much, members and Chair Pennel.
All right, moving forward to action item number 6, consideration and possible approval of the formation of the Central Nevada Health District pursuant to NRS 439.370. Rena works with us.
Dr. Murawsky, we have Marina here in person. We're just getting her set up for her presentation.
Excellent. Excellent.
Good morning. For the record, Marina works with UNR School of Medicine, and I'm here to present a proposition to approve the Central Nevada Health District as the third health district in Nevada. Next slide, please. So I'm just going to give you a quick overview of progress to date, the addition of the City of Fallon into the project, the services we plan to offer, how we're going to get our funding, and then finally with permission to form. So since the March Board of Health meeting when I presented, we have received approval from the governor and the interim finance committee to assume environmental health and the services under 441A for the 4-county region. This is including Eureka. We'll talk about that in a minute. We agreed to a structure with an administrator and a contractual health officer. We have drafted job descriptions for the administrator and the directors for each division. We have had ongoing meetings with the Department of Public and Behavioral Health to ensure a smooth transition of services and to have discussion on the distribution of grant funding. We have developed an operational plan to help keep us on track. We have held meetings in each community and to inform the public as well of the vision and the progress. And we have drafted interlocal agreements needed for the district. We have also drafted a budget. We have had regular updates with the individual counties at their Board of Health meetings. In the process of implementing county codes to abolish the County Board of Health and joining the district. And then we're preparing for the first District Board of Health meeting, which is tentatively scheduled pending approval today for December 8th. And we are looking at that meeting will be our kickoff meeting. So we'll have bylaws approved. We'll have the appointment of officers and appointment of a physician, approval of the interlocal agreements, and a Board of Health orientation, as well as some other miscellaneous items to get us going. I wanted to share with you our mission, vision, and value statement. The mission of the Central Nevada Health District is to enhance and protect a healthy community by meeting our unique rural needs. Our vision is healthy people, resilient environment, thriving community. And our values, adaptable to meet rural needs through integrity, commitment, advocacy, respect, and excellence. So we have added the City of Fallon since I talked to you in March. They were very excited to join in and be part of the district. And per NRS 439, it is allowable for a city or county or town to join. So they have officially submitted their interlocal and have joined forces with us. Okay, a snapshot. I wanted to give you the services that we're going to offer to start out, and we're hoping certainly to expand in the future as we get some strength and and some legs under us, but we're going to start with a public health preparedness program. We will develop an all hazards plan, and we will certainly have a disease investigation arm of that. There will be environmental health services, so we will doing the restaurant, pools, spas, hotels, schools, RV parks, and Burning Man. That will be the challenge, but we're gearing up for it. The state is going to help us, and we'll get through this first year. We are going to offer clinical services. We will have immunizations, family planning. We are going to get a plan in place for home visits. We have a lot of isolated people in the rural areas, and we feel like we've got to be able to meet the needs of the community. So that's not completely rolled out what that's going to look like yet, but there will be some sort of home visit for public health services. And then and whatever else we need to do to tailor to meet the needs of this specific communities we are serving. We'll have public population health management. So under that, we have community health workers that will be assigned to each area to help with the initiatives and again, to just get public health as robust as we can within this health district. Next slide. This is an example of our organizational chart where we have the Board of Health overall. We have the administrator under that. We are doing fiscal and other ancillary services will be handled by Churchill County through a contract. And then we'll have a contractual health officer. And then that's just showing the main departments that I just mentioned. So I won't go over all that. I just wanted to give you a snapshot of what it looked like. Funding to date, we have some grants. We're working off some workforce, ARPA funds, and other grants from the Department of Public Behavioral Health that will be determined. We have developed a formula for a county city to buy in, and what that looks like is that it's a $100,000 flat fee from each entity that wishes to join, and then they pay a $5 per capita. What we realize when you're dealing with rural areas is you can't fund strictly per capita, because to do that does not give you enough money to function and get anything done. So this is this formula is a little bit of a guess, if you will, but a good place to start. And then additionally on there, we've added a 20% contingency as part of the buy-in. And until that contingency fund reaches 200,000, which is where we want to keep it. And that would be, if you will, emergency funding should we need it. Otherwise, it's so we hang on to that and give us a little bit of cushion as we're moving forward. Okay. So with that, I would like to ask permission as required by NRS 439.370 subsection 3 that this is our formal request to create the Central Nevada Health District, and I'd certainly be happy to answer any questions.
Thank you. First, I wanted to open up to any public comment on this. Are there any questions from board members?
Yes, this is Trudy Larson. Marina, lovely work. Could you remind me of who will be on that the big Board of Health then for that district?
Oh yes, thank you. And I actually, I said I was going to even circle back to Eureka. So we have Churchill County, Mineral County, and Pershing County that will be all bona fide members, if you will. With the way NRS currently reads, it can only be at adjacent counties. So Eureka County will be joining in by contract, and we are anticipating that there will be a change during the legislative session this year, that they'll remove that word adjacent, and should that happen, then they'll come in as a full member. But those are the counties that are involved, and those are the ones that were in the planning process the entire time.
Thank you.
You bet. And then the Board of Health members are in the process right now of being named.
Just a question for the Department of Public and Behavioral Health. Do they have any comment on this formation, a support or any concern?
Lisa, this is Julia Peak. I don't know if you want me to cover it, but I'll just say on behalf of the agency, we could not be more proud of the folks for putting this together. This has really been a labor of love for the last decade, and it's only with COVID that we've actually had progress in this area. We're really hoping that the Central Nevada Health District will be a model for other counties, but so proud of this team so supportive of the work that they're doing, and we hope that they get your support as well.
Thank you, Julia. That was very helpful.
Dr. Pennel, if I might.
Yes.
This is Cody Finney, also a deputy administrator with Public and Behavioral Health. We've worked on our side of the regulatory side very cooperatively with this group, and will continue to do so related to some of the specific issues that we're still hammering out, including Burning Man and public health preparedness. So look forward to continue working with them and making sure we get all of those issues down to brass tacks.
Thank you. Any other questions from board members?
This is John Pennel. I don't have a question, but this is very exciting and I'm very glad to see it after all that work you've done.
Excellent.
Thank you.
Given that, then I will call this to a vote, looking for approval of the formation of the Central Nevada Health District pursuant to NRS 439.370. I'm looking for a motion to approve in a second.
This is Trudy Larson. I would move to approve the formation of the Central Nevada Health District. And
John
bravo
Pennel, second.
to all.
All right, and I have a second from Dr. Pennel. Excellent. All in favor, please say aye. Aye.
Aye.
Aye.
Any opposed, please note nay. Motion unanimously carries. Congratulations. Thank you. All right, moving along the agenda, we'll move on to action item number 7, consideration and possible approval or denial of variance number 740 regarding requirements of NAC 444.790 lot size submitted by Kathy Wise. Teresa Hayes from the Health Program Manager from Environmental Health Section.
Good morning, Chairman and members of the board. For the record, my name is Teresa Hayes, Environmental Health Program Manager for the Division of Public and Behavioral Health. I am here today to respectfully ask for you to approve the variance application for Ms. Wise. Ms. Wise is requesting a variance from the requirements of NAC 444.790 Section 1. The applicant is requesting approval to install an individual sewage disposal system for an unimproved lot. The lot in question is a total of 0.51 acres. The regulation requires a minimum of 1 acre for a septic system served by a domestic well. Environmental Health staff and Division of Public and Behavioral Health use data provided by the Nevada Division of Water Resources to calculate that there is a low enough density to accommodate the smaller lot. The majority of the lots surrounding Ms. Wise's property are between 0.51 to 1 acre. 4 parcels within the immediate area do not contain any septic systems. There is a 10.32 acre parcel to the west and a 30+ acre parcel to the northeast that do not have any septic systems, which creates a significant area of low density. Ms. Wise states that the strict application of the regulations would be unduly burdensome and abridge her property rights by rendering the lot unusable as a residential property. It is the opinion approval of this variance without conditions would not cause a detriment to the public welfare, nor substantially impair the purpose of the regulation. The division does not request any additional conditions to this variance. Pursuant to your question, this concludes my testimony.
Thank you. Is there any other public comment on the request for this variance? Hearing none. Is there any question from board members? I have no questions. Very clear, consistent. I'm looking for a motion to approve and a second from board members.
Carl Smith, I'll make a motion to approve for the variance number 740.
Smith?
Trudy Larson, I'll second that.
Thank you, Dr. Larson. All board members in favor of the variance, approval of the variance at number 740, please say aye.
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 Any board members opposed, please say nay. Motion carries. Thank you very much, and thank you for your work in putting this together.
Thank you.
All right, moving along the agenda, action item number 8 has been withdrawn. So we will move on to action item number 9, consideration and possible adoption of proposed regulation amendments to Chapter 433 of the Nevada Administrative Code, NAC LCB file number R009-22. The proposed regulation establishes a regulation regarding to mental health, establishing a procedure for whether to involuntarily administer psychotropic medication to a patient at a public or private mental health facility. Ms. Millay,
Yes.
Deputy Commissioner of BP, is with us.
Yes. Good morning, Chair, members of the board. Today, this request is for approval of the proposed changes to NAC 433 Legislative Council Bureau File R009-22. And as co-chair mentioned, relating to the mental health, establishing a procedure for determining whether to involuntarily administer psychotropic medication to a patient at a public or private mental health facility and other matters relating thereto. The Board of Health adopted regulation R012-20 on June 5th of 2020. That was pertaining to NAC 433 and NAC 433A. This regulation, as approved, outlined the process for involuntary administration of psychotropic medication to the patient at a public or a private mental health facility. Those regulations further outline that psychotropic medications may only be administered to a patient at a public or private mental health facility that have established those procedures set forth in the regulations. The proposed changes today revise Section 10 of LCB file, the Legislative Council Bureau file, R012-20, and are being proposed in accordance with NRS 433.324. The proposed changes clarify language: the patient must be currently admitted to a public or private mental health facility while under an involuntary court-ordered admission pursuant to NRS 433A.200. The changes also remove language that allows for involuntary administration of a psychotropic medication to a patient who is admitted under an emergency admission. Lastly, the proposed changes add clarifying language that on the criteria of admission and the needs of the client before administration of medication. Specifically, that language in Section 10.1 that an emergency admission pursuant to NRS 433.150 is striked out. And so it would only be under an involuntary court-ordered admission. And then also in Section 10.2A, the clarifying language of the is unable to care for himself or herself is removed, and the language will change to that the client is at risk of incurring serious injury or illness resulting from neglect of his or her basic need for food, clothing, shelter, or personal safety. Just for their clarifying that criteria before administration of involuntary medication. Following all procedures, there was a conversation with the Nevada Psychiatric Association clarifying what this new regulations occurred. There is no fiscal impact, and most hospitals actually already have adopted and follow the regulation changes. And with that, I'm happy to answer any questions.
Thank you. Is there any public comment on this item? Are there any questions from the board members? Just one question. In developing the criteria, these criteria talk about serious risk to self. Understand the clarification completely. Was there any consideration given to the serious risk of harm to others, which is sometimes used when we're talking about psychiatric stabilization? because that's not specifically included.
Thank you for that question, Jim, for the record. There had been the mental health whole crisis is, and that criteria of what danger to self or others, or as it says, serious harm to himself or others. There was no question of clarification. I think that's pretty clear. What we heard from some was more of what I had mentioned in the regulation changes. And other NRS changes seem to have clarified the serious harm to self in last session. And so those changes were not made in these regulations.
Thank you. Clarifies it for me. Any other questions from board members? With that, I'll call this to a vote. All in favor of the proposed adoption of regulations to Chapter 433, LCB file 9009-22. Please note by saying aye.
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 Aye. Any opposed, please say nay. By hearing none, the item carries. Approved. Thank you very much for all your work in putting this together.
Dr. Murawsky, apologies for the interruption. Kayla Samuels, administrative support for the record. Can you please reiterate who made the motion for the approval and who seconded?
Sorry.
This is Dr. Pennel. I'll make the motion.
Thank you. And who will second?
Judy Bittner will second.
Thank you.
Thank you.
All right. Well, thank you very much. We'll move on to action item number 10, adoption of proposed regulations to Chapter 439 of Administrative Code, LCB file R037-22. Programs for the treatment of persons who solicit prostitution to be certified by DPBH.
Dr. Murawsky, this is Autumn Blattman for the record. Letitia is here. She's getting set up, so we'll just give her one moment.
Hello? You can hear me?
Yes.
Okay, great. Chairman Pennel, members of the board, for the record, my name is Letitia Medlow. A health program manager with the Bureau of Healthcare Quality and Compliance. I am here presenting for your consideration proposed regulations, LCB file number R037-22, related to the certification of programs for the treatment of persons who solicit prostitution. Oh, last time I had to go up there.
Dr. Murawsky, we're just going to have her move so we don't get any feedback. Apologies for the delay.
Thank you. No problem.
Okay. Oh, did we turn that one off? Yes. Okay, thank you. Okay, so this is related to the certification of programs for the treatment of persons who solicit prostitution. These changes are needed as statutes exist which allow for a justice of the peace or municipal judge to order customers of prostitutes who have been convicted of a misdemeanor that constitutes solicitation for prostitution to participate in a program for the treatment of persons who solicit prostitution, which is certified by the division. As no such certification currently exists, the proposed regulations establish certification of these programs for the treatment of persons who solicit prostitution. The proposed regulations were moved forward in accordance with NRS and NAC Chapter 233B, the Nevada Administrative Procedure Act. A public workshop was held on July 20th, 2022. There was one person that testified in support of the proposed regulations, and no one testified in opposition of the proposed regulations. Sections 3 to 8 define terms used in the proposed regulations. Sections 9 to 13 outline the requirements related to applications, including the addition of locations, licensure by endorsement, and the initial and renewal applications. Section 14 requires the division to maintain and post publicly on the internet a list of certified programs. And it also addresses if a certificate expires or is suspended or revoked. Section 15 and 16 address related fees. Section 17 and 18 address the curriculum and instruction materials to be used by a program. Sections 18 through 24 and sections 26 to 29 outline the operational requirements of a program, such as approval and use of facilitators, course topics, training, continuing education, the duration of the program, group counseling, program evaluation, the use of distance media, program participant agreement, certificates of completion, discharges, treatment terminations, confidentiality of records, and those kinds of things. Section 25 prescribes the qualifications and duties of the director of a program. Section 30 addresses the formal training and continuing education requirements. 31 through 33 address disciplinary action against a program or facilitator. Section 34 is related to appeals by a person's agreed by decision of the division. Section 35 is related to the suspension of the certificates of a program or approval of a facilitator. It also describes the required contents of a written warning issued by the division to a program or facilitator. Sections 36 provide notice from the division that will be deemed sufficient if sent to the last address or the electronic mail provided by the person. Section 37 authorizes the division to conduct an on-site inspection of a program at any time to determine that it's in compliance with the regulations. Section 38 addresses complaints filed against a program. Section 39 requires a program that is located outside the state to reimburse the division for certain costs to inspect or investigate a program that's out of state. It also requires a program to submit a plan of correction for each violation identified in the report of the inspection or investigation. Section 39 provides a plan of correction is confidential until it's approved by the division. Section 40 prescribes the conditions for the release of the report of the inspection or investigation of a program and provides that the proceedings and investigations resulting from the submission of a complaint are otherwise confidential. Staff recommends the State Board of Health adopt the proposed regulation amendments to NAC 439, LCB file number R037-22. And if you all have any questions, I am here.
Thank you. Is there any public comment on this item? Are there further questions from board members? Hearing none, I will look for a motion to approve the proposed regulation amendments R037-22. Can I get a motion and a second, please?
Earl Smith, I make a motion to approve the amendments to Chapter 439 Administrative Code NAC LCB file number R037-2.
Smith?
And this is Trudy Larson. I second that motion.
Thank you, Dr. Larson. Who approves, say aye. Aye.
Aye.
Any opposed, please note by saying nay. Motion carries. Thank you all. Thank you for the hard work and put in this very comprehensive training program, regulations, and process together. It's very comprehensive.
Great, thank you.
All right, we'll move on to action item number 11, consideration and possible adoption of regulation amendments to Chapter 449 of the Nevada Administrative Code, LCB file 04822, medical facilities, other related entities, infection control and prevention, use of audio video monitoring, national reporting accreditation status to DPBH practical technology, changes to home health agency, ambulatory surgery center, community living based facility for hospice regulations and other matters. I understand there may be some sections of this that are being withdrawn from consideration as well. I'll ask for Ms. Metherell.
Thank you. Chairman Pennel and members of the board, for the record, my name is Letitia Metherell, Health Program Manager with the Bureau of Healthcare Quality and Compliance. I am here presenting for your consideration proposed regulations to LCB file number R048-22 related to healthcare facilities. The proposed regulations were moved forward in accordance with NRS and NAC Chapter 233B, Nevada's Administrative Procedure Act. The proposed regulations were drafted to align Chapter 449 of Nevada Administrative Code with the passage of several bills passed during the 2019 and 2021 legislative sessions. In addition, the proposed regulations address several issues identified in the past several years, including infection control and prevention, construction and life safety code standards for facilities of hospice care, and other provisions. A public workshop was held on September 28, 2022. Concerns expressed during the public workshop included concerns related to the provisions addressing the sexual assault or attempted sexual assault training required by NRS 449.302 found in sections 41, 47, and 80. The concerns are addressed in the proposed errata. Concerns related to omitting the provision in NAC 449.996 requiring an ambulatory surgical center to maintain a written patient transfer agreement with the hospital in Section 68. This recommended change was not incorporated into the errata, and reasons for not making this recommended change included surgical centers are required to establish written guidelines for transferring a patient to a licensed hospital, and the proposed regulations clarify the hospital must have surgical and medical capabilities. All medical and administrative information related to the patients are to be transferred with the patient or to be promptly available to the licensed center or agency responsible for the patient's continuing care. In 2019, CMS did remove the requirement for an ASC to have a written transfer agreement with a local hospital. One article noted that according to CMS, this was meant in part to address the competition barriers that currently exist in some situations where hospitals providing outpatient services refuse to sign written transfer agreements. The article also noted that at the time the rule was finalized, 14 states, including California, did not have written transfer agreements. The Emergency Medical Treatment and Labor Act, known as EMTALA, emergency response regulations would continue to address emergency transfers of a patient from an ASC to a nearby hospital, and emergency medical services would implement their procedures to ensure a patient is transferred to a higher level of care based on a patient's condition. The third concern expressed was concerns related to requiring personnel receive all trainings required by NRS Chapter 449, including family member caregivers providing care to their family, taking the entire cultural competency training in Section 44. The recommendation to modify the proposed regulations to provide a waiver or exemption to family members that care for family from having to take the cultural competency training was not included in the errata. The cultural competency training is a statutory requirement. Therefore, the Board of Health does not have authority to waive or exempt these requirements. Written testimony expressing several concerns with Section 5 relating to the use of audio-video monitoring equipment was expressed. And based on those concerns, the errata proposes to omit Section 5 completely from the proposed regulations. So now I'm going to present an overview of the different sections of the proposed regulations. Sections 1 and 5 are being recommended to be omitted from the proposed regulations. Section 3 adopts by reference certain guidelines concerning the use of personal protective equipment. Section 4 requires facilities to follow guidelines and to take certain measures to ensure that the facility maintains an adequate supply of personal protective equipment. Section 6 requires a medical facility that acquires or loses accreditation to notify the division and authorizes the division to impose administrative penalty for such failure. Section 7 requires a facility for the dependent to develop and carry out an infection control program and an emergency preparedness plan, and to designate 2 employees to be responsible for infection control at the facility. Section 8 addresses construction standards for a facility for hospice, and 26 addresses the fire safety standards. Section 44 requires a personal care agency to ensure employees are provided all training required by Chapter 449 of NRS and NAC. Section 10 provides that the personal care agency may satisfy that requirement by providing or arranging for the provision of such training. It also requires the agency to pay certain costs associated with training, the salary or hourly wage of the employee for the time spent attending the training. Section 13 prescribes a different class designations for surgical centers and operating room space requirements. And Section 19 requires identification of the class designation on an application for an ambulatory surgical center. Section 14 prescribes certain qualifications for a surgical technologist who does not possess the qualifications prescribed in NRS 449.24185 to engage in the practice of surgical technology. Section 15 prescribes community-based living arrangement services training requirements. Section 16 addresses the CBA administration and medication requirements, including administration of over-the-counter medications or dietary supplements. Section 2 addresses surety bond requirements for CLBLAs, and 63 requirements to maintain sufficient staff to meet the needs of the persons receiving care. Section 17 addresses procedures to address immediate serious threat to the health and safety of residents or patients identified at a facility. Section 18 and 67 update titles and prices of other publications that are adopted by reference. Section 20 exempts from the requirement to receive a fire inspection certain entities that are required to obtain a license or certificate from the division. Section 24 removes the requirement that complaint must be submitted by a consumer. Section 28 authorizes a residential facility for groups to retain a resident with a serious infection during an epidemic or pandemic if the resident does not have symptoms that require a higher level of care than the residential facility is capable of providing. Section 27 revises requirements governing the size of the windows in a bedroom of a residential facility for groups. Sections 41, 47, and 80 address the victims of sexual assault or attempted sexual assault training for applicable employees of hospitals and independent centers for emergency medical care. Section 5 addresses abuse and neglect of residents in psychiatric residential treatment facilities. Section 46, 52, and 70 revise provisions governing facilities of the treatment of irreversible renal disease, skilled nursing facilities, recovery centers relating to who is authorized to order or prescribe as appropriate a therapeutic diet for a patient at these facilities. Section 50 revises the requirement dimensions of doors to certain rooms that permit access for wheelchairs at an intermediate care facility. Section 60 brings home health agency regulations in line with existing law by authorizing a physician assistant or advanced practice registered nurse to order home health care for a patient. The proposed regulations also omit a large portion of the state home health agency regulations and instead align them more closely with the federal CMS home health agency regulations by adopting those by reference and requiring that licensed home health agencies follow those. Section 68 removes the requirement that each ambulatory surgery center must maintain a written agreement with a hospital concerning the transfer of patients. Section 71 requires a pharmacy conducted by a recovery center to be licensed and a recovery center to comply with the requirements concerning the signing of chart orders. Section 73 and 74 establish requirements concerning the confidentiality of a statement of deficiencies and plan of correction. The proposed errata includes several changes to the proposed regulations, including removal of Section 1. The proposed regulations were heard at the Joint Interim Standing Committee on Health and Human Services, and concerns were expressed regarding Section 1 related to the power to require any person or entity in Nevada to report in accordance with that section. As NRS 233B.039 Subsection 5A gives the State Board of Health authority to order reporting in response to a pandemic or epidemic. It was determined this section was not necessary and that it should be omitted. The RADA also includes removal of Section 5, as I previously noted. The proposed RADA also makes several modifications to the proposed regulations, including the correction of a drafting error in Section 8, subsection 1B, which starts off as the division period and it's followed by an unrelated sentence, so it just fixes that. It changes the word may to must in Section 13 to require ambulatory surgery centers to have operating rooms that meet minimum area and space requirements based on the complexity of a surgery instead of just being permissive. It changes the requirement for a facility for hospice care to comply with the federal fire protection regulations instead of the standards adopted in NAC 449.0105. It revises sections 41 and 47 by adding provisions detailing the sexual assault or attempted sexual assault training components needed to comply with the training required pursuant to paragraph F of subsection 1 of NRS 449.0302, and it modifies section 80 to refer to those modifications. Staff recommends the State Board of Health adopt the proposed regulation amendments to NAC Chapter 449 along with the associated errata, and I am available for any questions.
Thank you very much. I'd like to open it up to any public comment on this agenda item at this time.
Hello, I have some. Can you hear me? Hello?
This is Autumn Blattman. Yes, please state your name for the record, and I will have a timer. Just give me one moment, please.
Okay, thank you, Autumn. This is Connie McMullen, representing the Personal Care Association, and I'm ready to start when you are.
Please.
On behalf of the Personal Care Association of Nevada and Advanced Personal Care Solutions, a Medicaid contractor provider, I'm Connie McMullen, testifying on regulations proposed in Item 11, Chapter 449, Section 44 and 10 regarding training of caregivers working for personal care agencies. Training for unlicensed caregivers is an important issue, yes, but everyone should know that in the personal care industry, licensed agencies must train caregivers to a set of standards in NRS before providing care, along with an additional 8 hours of training annually. Personal care agencies train on 16 topics before a caregiver can provide personal care, and the Division of Healthcare Quality and Compliance inspects the agency's training records regularly. Many agencies use nationally recognized training platforms and have spent years developing thorough and consistent training. Because training in the personal care industry is already regulated and because training systems are already in place, PCAN would like to propose a couple of alternatives. One, caregivers employed by licensed agencies should be excluded from the requirement since they already receive and meet training requirements under existing regulations. And two, that the current training requirements for personal care agencies should be used as a model for unlicensed caregiver training. There are personal care agencies that are more than happy to assist in developing standards for unlicensed caregivers that caregivers already are meeting, and HCQC could provide support due to their regulation of current training requirements of those agencies. I thank you for allowing me to speak today on behalf of the personal care industry, and happy holiday to you.
Would the state like to respond to that for the board?
Yes, Letitia Metherell for the record. So the proposed regulations just say that they have to ensure that such personal receive training that's already required by Chapter NAC and NRS of 449. So it's not adding more training requirements. It's more related to having to pay personal care attendants for taking those trainings and for their hourly wage and things of that nature. So based on the comments, it appeared that it was more geared towards additional training. So I'm not quite sure how I would be able to assist that individual, if that makes sense.
Can I respond?
Yes.
Yes, I think
Oh, sorry.
the issue here is licensed personal care agencies. Most of their employees are employees. And so as an employee, they do have to do this under national labor laws. If they were not employees, they are contractors. I believe that's also a labor issue. So we're just guaranteeing that it's in there. And if more training does come down the line, that we would like to certainly be included in that. Thank you.
Yes, and we would be happy to take any comments or suggestions for any other trainings or things like that. We would be happy to work with you if you have those suggestions.
Dr. Murawsky, it's a question for you. In reviewing the small business kind of impact analysis, I don't see where that increased cost to the business was considered in doing that analysis. So my question is, what's the impact of if we're going to force the payment of the worker who's not an employee and not covered under the labor laws that would already force them, would require the payment to be made? How do we accommodate for that in adding this requirement to those employees who wouldn't be covered by other laws?
Letitia Mather for the record. Yeah, I believe the small impact statement does acknowledge that there would be an increase for some facilities. Some agencies already provide the cost and pay for training. Some may not. So yes, it does. It does recognize that it may cause an increase in cost to the programs. We did have one individual in the small impact statement. It's in the comments section. Note what they felt those would be. I have to pull up the small impact statement here. I have it here. And they did provide estimates. I didn't get estimates from every agency on what they felt the cost would be, but if I can find my small impact statement here, I know that there is.
The one that I'm into.
Oh, here it is. I have it. Sorry. So, yeah. So, according to on page 5 of the small impact statement, there was one that wrote, "We are a PCA agency that is not workable for us. We do not receive funding," and here, freedom. Oh, so this is actually an ICO, but anyways, what they noted here was, however, we administer personal care agencies for approximately 450 Medicaid patients. Section 44 of the proposed regulations specify that the administrator of PCA is required to ensure employees are provided training, which they estimated the cost would be approximately $45,000. Additionally, Section 10 requires the agency to pay certain costs, and these costs would result in $40,000 of additional wages to be paid annually. So I didn't get it from everyone, but for that particular entity, which turned out to not be a personal care agency, but they did outline those as the costs. I don't know if those would be similar costs to other agencies. It might be dependent on the size. Like I said, some may already be providing these services and paying for them, some may not. And that's the information I have at this time on that.
Kayla Samuels for the record. We have one public commenter up in Northern Nevada, and then we'll proceed with the virtual commenters. Jeanne Bishop Paris, please go ahead.
Chairman, members of the board, can you hear me? Chairman, members of the board, I am Jeannie Bishop Paris, and I am currently Health Service Executive number 3 for the state of Nevada. I recently retired from, oh, I'm sorry.
apologies. There's some feedback up here, so we're going to have her move to one of the mics on the desk. Apologies for the delay.
Chairman, members of the board, I recently retired, but I was 10 years at an assisted living facility and then 20 years doing skilled nursing facility administration. So I just have concerns because of how the cultural competency morphed into a very specific training that was unique to Nevada and required all new employees within 30 days to get their training done. And it's different for the association, for the nursing facilities and assisted livings. It's different for the Board of Nursing, and it's different through the university system, which is 9 hours, and then the associations are 3 hours, which is cumbersome, and I think that's why they tried to remove that requirement from families. And in looking at how Section 7, number 4, the persons designated pursuant to subsection 3 as responsible for infection control shall complete not less than 15 hours of training concerning the control and prevention of infections provided by the Association for Professionals in Infection Control and Epidemiology, the Centers for Disease Control and Prevention of the United States Department of Health and Human Services, the World Health Organization, or the Society for Healthcare Epidemiology of America, or a successor in interest to any of these organizations, not later than 3 months after being designated and annually thereafter. I think we might be heading down the same path with the language being too specific and not allowing for, as Connie mentioned, you know, some of the wonderful nationally accredited programs, ones that can be done anytime online.
Excuse me, Ms. Bishop Parise. The time's over, so if you wouldn't mind concluding your comments.
Yes. So I really think that the language needs to be amended and the terms for approval through the Bureau less stringent than the cultural competency training.
Dr. Murawsky, would the state like to respond?
Letitia Metherell for the record. The cultural competency training regulations aren't addressed in here. The PCA agencies, it just refers back to saying that they have to take all the statutory required requirements as far as payment and stuff like that, which one of the statutory requirements is the cultural competency, but those aren't specifically addressed in these regulations. So I will address the Section 7 infection control. So it says to carry out the infection control program developed pursuant to subsection 1, the facility shall adopt an infection control policy. And the policy must include without limitation current infection control guidelines developed by a nationally recognized infection control organization that are appropriate for the scope and services of the facility. So then it says such nationally recognized. So those are examples of nationally recognized standards that a facility can adopt. It doesn't say that they have to adopt every one. They can choose one, and they can choose one that's appropriate for the scope and services of the facility. The main goal here is that we're want to ensure that the policies are done in accordance to evidence-based practices. So these are standards that are evidence-based practices. And so, you know, there may be other programs out there, accreditation programs, things of that nature, but to evaluate to see if those are evidence-based, that would be a separate thing. So nationally recognized standards are what we go by to ensure that a program is based on evidence-based, if that makes sense.
Thank you for the response, and Dr. Pennel, Chair. I believe that if there was another or alternative program that they felt they wished to use for said training, they could apply for a variance through the board process and obtain a variance to add another program, which then would lead to regulation amendment later potentially.
I'll leave that response to our Deputy Attorney General.
Do I just press? Is this on? Okay. This is Piran Takis, Deputy Attorney General, for the record. Anything that's passed in regulation by the Board of Health is subject to the variance process. So it would go through the typical review where they apply for a variance, and then it would be considered by staff and then the Board of Health. So just generally that would apply.
Thank you. Autumn, are there other comments public comment you wish to tee up?
Marlene Locker, please go ahead for public comment.
Marlene, if you are speaking, you're on mute.
Okay, I'll try this. My name is Marlene Lockard, and I was involved with the legislation of SB 340 during the last legislative session that passed SB 340. One of the main issues that we found that personal home care workers experienced was inconsistent training throughout the industry. And while some provided training, all did not. So a healthcare standards board was created, which exists of providers, home care workers, and care recipients. And it was a unanimous decision after much work, investigation, and study to make our training recommendations that are contained in the regulation before you now. As I said, providers were on this board, and that recommendation passed unanimously by the Personal Care Board, and also was approved by Director Richard Whitley. The home care worker regulations are inconsistent. In one section, training is mandatory, in another, it is not. And so another purpose for this language was to remove the ambiguity that previously existed. So there are over 300 personal care providers in the state of Nevada. And if you look at the public response, you will see just a very minimum number of agencies responded to this provision. And
Ms.
again,
Lockhart, excuse me, Autumn Blattman, for the record, the timer's up, so if you wouldn't mind concluding your comments. Thank you so much.
We strongly recommend approval of this regulation. Thank you.
Is there a further public comment?
Yes, one more. Farron, please state your full name and then proceed with your public comment.
Hello, my name is Farron Epstein, and I'm a home care worker for my son, Evan Friebowitz, who is an incomplete quadriplegic. I'm also a member of that Home Care Standards Employment, the Home Care Employment Standards Board, which Marlene just spoke about, which was established by the Department of Health and Human Services last year. Home care workers carry out all the duties that allow seniors and people with disabilities to live in their own homes with dignity. The demand for home care services has been skyrocketing as Nevada's population ages faster than the rest of the country. Despite our essential work, home care workers make only an average of about $11 an hour, some as low as $7 an hour. And most do not have any health care or paid time off at all. As inflation has shot through the roof, we're struggling just to survive and afford the basics like food, electricity, rent, and gas. On top of these poverty wages, most home care workers have the added burden of being required to pay for our own job training, and we have to attend the meetings on our own time, unpaid. Some of us without respite care to even take care of the people that we're insured with watching. These type of out-of-pocket costs have aggravated a severe workforce shortage, and many families simply can't find the home care services that they desperately need. And that's why the Home Care Standards Board passed that recommendation that employers, not workers, should be responsible for covering the costs of training, and workers should be paid for attending the trainings. We have to solve the spiraling home care crisis in Nevada, and lifting the burden of training costs for struggling caregivers would be a major step in the right direction. I strongly urge the Board of Health to approve this amendment. Thank you.
Thank you.
Thank you.
Autumn, are there any further public comment?
Cody Finney, please go ahead.
Thank you. Chair, I am Cody Finney. I'm a deputy administrator for the Division of Public and Behavioral Health, and I have also acted as the chair on behalf of the Department of Health and Human Services for the Home Care Employment Standards Board that's been referenced here. I just wanted to offer that to answer any questions the board may have about our recommendations and those purposes that may have been not clarified yet. Thank you.
Thank you. Autumn, any further?
There appears to be no further public comment. I would recommend that we just give a moment in case anyone was unable to figure out the raise hand function if they would like to give public comment. Ms. Bishop Paris has requested to ask one final question. Is that permitted?
Yes.
Is there currently an online option for the 15 hours of training that would meet the requirement of being provided by the Association of Professionals in Infection Control and Epidemiology?
There are online classes because, like I said, the facility can choose and say, okay, we're going to do the CDC standard. It doesn't say they have to use that particular one. The CDC does have a lot of online infection control and prevention trainings, and we will be posting some of those, what are available on our website.
So online, they could meet the requirement for the 15 hours?
Yes,
Okay.
They can meet the requirements online.
Alan Ward, please go ahead for public comment. Mr. Ward, you are on mute if you're trying to speak.
Thank you. This is Alan Ward. I'm owner and operator of Home Instead in Northern Nevada. We are a PCA agency. I just wanted to clarify that our current market rates for wages in Northern Nevada is $15 to $16 and even $17 for our workers, our personal care agencies. And we do pay for training. It's 16 subjects, unless you're in Medicaid. And this is just for the record. And then finally, really, labor law requires us, anytime you're training any of your employees at any time, labor law requires you to be paying them. I just wanted actual facts in the industry from our side. Thank you.
This is Autumn Blattman for the record. Oh, I saw Marlene had her hand raised again, but she lowered it. Thank you. Sorry, this is Autumn again. Ms. Lockard, generally we don't allow second public comment, so I'm not sure if you're trying to raise your hand, but you can possibly email this in writing to the State Board of Health email if you have additional comments.
Thank you, Autumn. Is there anyone with a first public comment?
Kayla Samuels for the record. There appears to be no more in the chat looking for public comment, and I believe you can proceed.
Okay. Then let me just ask questions from board members. It's Dr. Murawsky. I'll just form my first question. So we've had a lot of discussion around Section 10. The question I guess I would ask is there anything in Section 10 that's not already mandated in other regulations or federal law? Or is this creating a new requirement for compensation for any class of individuals?
This is Letitia Metherell for the record. I would have to defer to our DAG to see if there are other federal or state laws that address compensation for training. I'm not aware of that.
This is Cody Finney, Chair, if I might.
Please.
Thank you so much. I just would like to offer that the purpose of our seeking this regulation in part is that we understand that this is, we the board, the Home Care Standards Board, understand that this does not create a new requirement. Rather, it gives HCQC the necessary authority to monitor the implementation of this law. It is our understanding that labor law does cover much of this, but labor law is enforced by the Labor Commissioner's Office. And what we're seeking here is to ensure that we at HCQC can assist and review that the burden of any training is not left to individuals, but rather is associated with the healthcare facilities. So I'm hopeful that helps to clarify, but also defer to our DAG, of course.
This is Piran Takis, Deputy Attorney General for the record. Thank you for that response, Cody. I didn't come prepared with any legal analysis relating to that question. I'm happy to look into it and report back, but I think that Cody's response addressed the board's question.
Thank you, Ms. Finney. That addressed my question. Are there other questions from other board members? With no other questions being noted, I will look for a motion to approve action item number 11, LCB file 048-22, removing sections 1 and sections 5 with the errata as provided. Looking for a motion and a second.
Dr. Pennel, I'll make the motion to approve.
Charles Smith.
This is Trudy.
All right, I have a motion and a second. For all board members, all in favor, say aye.
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 Any opposed, please note nay. Any abstentions? Hearing none, motion carries. Thank you very much. Moving on to action item number 12, consideration and possible adoption of proposed regulations to Chapter 433 of the Nevada Administrative Code, LCB file 093-22. Proposed regulations are needed in order to come into compliance with and line with regulations in NRS 433.631 and 433.639 and 433.631 peer recovery support services. Ms. Metherell, please.
Chairman Pennel and members of the board, for the record, my name is Letitia Metherell, Health Program Manager with the Bureau of Healthcare Quality and Compliance. I am here presenting for your consideration proposed regulation, LCB file number R093-22, related to peer recovery support services. The proposed regulations were moved forward in accordance with NRS and NAC Chapter 233B, Nevada Administrative Procedure Code. A public workshop was held on June 8th, 2022. No testimony in support or opposed was provided during the public workshop. Section 2 prescribes a process for the investigation of a complaint alleging a violation of NRS 433.631 related to the provisions to be certified by the Nevada Certification Board to provide or supervise peer support recovery services or to work as a peer recovery support specialist intern, or a violation of NRS 433.639 as it relates to disqualification of individuals with a substantial report of child abuse or neglect, or certain related violations from providing or supervising peer support recovery services if the individual works in a position that has regular and substantial contact with minors, and authorizes the division to disclose any information collected as part of such an investigation to the Nevada Certification Board. Section 3 prescribes the civil penalties that the division may impose for a violation of the provisions of NRS 433.631 or 433.639, and authorizes a person aggrieved by the imposition of such a civil penalty to file an appeal with the division. Section 4 prescribes the confidentiality requirements related to complaint investigation conducted pursuant to Section 2. NRS 433.639 authorizes the division, in consultation with each agency that provides child welfare services, to establish by regulations a process which allows an individual found to be disqualified to provide or supervise peer support recovery services in a position where the person has regular and substantial contact with minors pursuant to NRS 433.639 to be able to provide such services despite the report disqualification. The division consulted with each agency that provides child care services when drafting the proposed regulations to establish the process. And then Section 5 actually does establish that process. NRS 433.639 also requires the adoption of regulations to establish civil penalties to be imposed against any person or entity that fails to comply with the requirements of NRS 433.639.